Hi everyone, so I am here today to talk about one of my favourite subjects, which is bowels and poo. I feel like I've spent half my life actually dealing with people's bowels in one way or another. Back when I was a surgical nurse, I would look after numerous patients who'd had bowel surgery, maybe had colostomies, and was even known to fish through people's diarrhea with my fingers, which was lots of fun. I have IBS myself, so I know how much having a bowel condition can really affect your quality of life sometimes. And I also had a physically disabled child who had cerebral palsy, and part of that disability meant that she was very prone to constipation and bowel blockages. I've kind of used massage, obviously, for her as a routine treatment. So for the purpose of this video, I am going to be looking mainly at IBS and also childhood disability. But many of the things that I talk about here will apply to other bowel conditions also. So as far as IBS goes, it affects the colon, which is your large intestine, and it's probably one of the most sort of common bowel conditions out there. While it doesn't permanently damage the large intestine, it can actually really restrict someone's lifestyle because of the symptoms. But massage can really help offer some natural relief to those symptoms. And by symptoms we're talking about things like constipation, diarrhea, bloating, abdominal cramps and pain, fatigue, both urinary and fecal urgency, frequency, excessive flatulence, things like that. So the big problem is that actually to find a therapist who actually does it. And certainly if you've got a bowel condition, you really want someone who is experienced in dealing with that. And likewise for childhood disability as well. A lot of therapists out there actually, they say they do full body massage, but actually they don't, and they don't include the abdominal massage, which is so beneficial, for so many reasons, both in terms of just, helping with stress and emotional, issues, maybe during a Swedish massage. It can actually sort of work around the solar plexus and the sacral chakras, which can really help boost a person's self-esteem, self-confidence, and give them a feeling of optimism moving forwards. But also, in terms of sort of those physical issues as well, it can really help, promote good digestive health and restore balance to the digestive system. So, as I say, you just need to find a therapist that is experienced in dealing with this problem. And I think for clients as well, because it's not something that everyone routinely gets in a full body massage, quite often I find that clients can be a little bit hesitant to have a stomach massage. I'd say more so men, sometimes due to just they feel that area of their body they're not confident with, and so they don't want someone touching it. And for a lot of clients, it's things like they just don't like the whole sort of subject and thinking about their bowels and poo and wind and things like that. So but it really is beneficial, and I'd say all of my clients that have had an abdominal massage, not one of them has, found it uncomfortable or not enjoyed it. So it really is worth, going out there and having one. So with regards to the symptoms of IBS, I'm going to go through those symptoms and really just talk about how massage can help with those. Obviously symptoms will vary from one person to another. They can be triggered by certain foods. I know for me, white bread and lentils are just a no-go most of the time. Hormonal imbalances, if you're going through the menopause, you may find that it really kicks off, or at the time of the month. Stress and anxiety as well can be a really big trigger for IBS, and certainly that's something that I've found with mine. So with regards to the actual symptoms, so one of the main symptoms is constipation. And where massage helps is it will really help stimulate the peristalsis in the bowel, which is that movement where, it kind of contracts and relaxes and consequently pushes the feces through the bowel. So massage will really help improve that peristaltic movement of the bowel and regulate it, which then will decrease the colonic transit time and increase the frequency of your bowel movements. So hopefully then you're not having those episodes where you're sitting on the loo for about half an hour just trying to get one tiny little piece of poo out. And in doing this, in promoting a more regular bowel movement, it will also then help reduce any discomfort and pain and cramping that is so common with the IBS. So obviously the other end of the scale is diarrhea, and for this, massage can still help. We simply do the techniques in an anti-clockwise direction, which can kind of almost create a mild tension in the bowel. And what this does is it then helps to not only relieve pain, but just calm the intestines down, and sort of help, sort of prevent any more of that cramping. Sometimes the diarrhea can be caused by a problem with the ileocecal valve in the bowel, and that may take a little bit more work to resolve that issue. But yeah, so just by doing the techniques in a different direction of the bowel, you can kind of use the massage to help with either the constipation to promote, more bowel movements, or with the diarrhea to just help regulate and calm the bowel down. So another thing that is very common is bloating, and again, where massage really helps to improve this peristaltic movement of the bowel, and help move those, stools along. By doing that, it actually, helps prevent that build-up and helps prevent that feeling of bloating, which can also really, increase fatigue levels and make you just feel, like you got no energy. So another thing that this improved peristaltic movement will help, and the movement of the stools being, pushed through the bowel, what that does is it actually also reduces the pressure in the bowel, which means less pressure in the bowel, you're going to have less build-up of gas, which means less farting. So, and for anyone who's suffered IBS or probably any other bowel problems, you'll know, when you're in one of those episodes where there's a lot of gas, you don't want to be socializing, because it really, it can be quite offensive even to you, let alone other people. So if massage can help, just reduce the pressure in the bowel, reduce the issues with build-up of stool and therefore, trapped gas around the bowel, that's really something that can help improve your quality of life. So likewise, the other thing that this reduction of pressure in the bowel will help is with the pain and the cramping in the bowel. Also it in regulating the peristalsis, it will also help to reduce sort of overstimulation of the bowel, which may be due to certain foods or stress. And when, the bowel isn't overstimulated, we're not going to get those sensations of urgency and frequency and having to run to the loo, because we're worried that, there might be an accident. And this can really help, with things like just getting to work or just being able to drop the kids to school. It can really make a difference. And again, just regulate those bowel movements. And also, in terms of the bladder as well, a lot of people that suffer with IBS, actually, it does affect their bladder as well. So they get that real urgency and frequency to pee as well. So massage will also help with this. And as we've said, in terms of fatigue and reduced energy caused by this sort of build-up of stool that's just sitting there not doing anything, the muscles that line the intestinal wall, in someone with IBS or other bowel disorders, the linings of the intestine walls will actually contract, much stronger. And so what happens then is that food will, often pass through the colon a lot faster, hence why you get diarrhea and why you get gas. Or it passes through too slowly and your bowels become sluggish and you end up constipated. So, and it's these things, when your bowel is kind of overworking and, sort of almost in overdrive and just constantly increased bowel movements, with diarrhea, or where it's just slowing right down and you've got just large amounts of poo just sitting there, which is going to increase sort of, chances of infection and things like that. These things are going to have an impact and they're really going to, increase, your fatigue levels and just you're not going to want to do anything. So again, this is how massage, can really help improve things for someone with a bowel disorder. So, as we've said, IBS symptoms can be made worse through certain foods and through stress. Just want to sort of emphasize the fact, stress does not cause IBS, but it can certainly increase the frequency and the severity of the symptoms that we've just been discussing. So, massage can also help, even just in a general sense. Even a general full body massage can just help by reducing the stress levels, through that, as we've talked about so often, the reduction of the stress hormones, reduced cortisol release and adrenaline, and just increased endorphin release, those feel-good hormones. And so again, by, working on the stress and just relaxing the body, relaxing the tissues, massage also, in that way can really help with IBS and other bowel disorders. So I'm going to talk also about how massage can help, obviously, with constipation, certainly with regards to a lot of physically disabled children. Quite often, certainly cerebral palsy, there will be certain bowel medications prescribed, whether it be something gentle like lactulose, sort of up to the, less pleasant end of the scale, where things like suppositories, which, let's face it, for a child, are really not, you don't want to be giving them suppositories if you can help it. So if there's a natural alternative, such as massage, that can actually help unblock the bowel, then why not? If it avoids, having to give them a suppository, they'll certainly like you much more for it. So yeah, I've got about 9 years experience in using abdominal massage for physically disabled children. And that's really to reduce constipation, and really to prevent, as I say, prevent bowel blockages, which, if the medication can't resolve it, which sometimes it doesn't, then, what happens is that child can then actually have to go through, some sort of minimal sort of surgical procedures, which again, no one wants their child to go through that. So, again, this is where massage comes in. There are certain massage techniques that would be used. Use of pressure points, can again stimulate the peristalsis, which certainly in cases of cerebral palsy, the peristaltic movement is really kind of slowed down and sluggish, and that's why they are so prone to these bowel blockages and to constipation. And sluggish digestion, again, that's going to be improved, which, if you've got sluggish digestion, your metabolism is going to be affected. Anyone who has a child with cerebral palsy, particularly spastic cerebral palsy, will know that that constant state of contraction in the muscles, means that that child's metabolism is actually working probably twice as hard as that of any child who doesn't have the disability. So by improving the, sluggish digestion, we're then helping to improve the metabolism, which will only benefit your child. Obviously, there is the element of, the massage will relax the abdominal the abdominal muscles. And in that way, again, it just helps the digestive system to work more efficiently. When someone is stressed, as we've said, that can impact on the peristaltic movement of the bowel and really increase the chance of constipation as well. So yeah, by relaxing those muscles, helping to relieve the bloating and the wind, which again in children with something like CP, the reduced peristaltic movement, that build up of really old stools in some cases, you're going to get a lot of trapped gas, you're going to get increased pressure in the bowel, which in really severe cases could actually lead to perforation of the bowel. So yeah, the aim is to really just introduce a more regular pattern of bowel movements, and to prevent these issues from arising. So massage is a really good preventive measure in children, and they actually enjoy it. There's nothing unpleasant about the abdominal massage. And it may also, through the relaxation, also help that child, if they have sleeping issues and things like that as well. So that's an added bonus. Now, for an experienced, and this is why I say go to an experienced practitioner who has experience of these childhood disabilities and experience of doing an abdominal massage for these issues. Because, for someone like me who has dealt with bowel health for years, I've dealt with childhood disability and blocked bowels, and all these issues. I've worked as a midwife, so I'm used to palpating people's abdomens as well. It's very easy for someone like me to palpate someone's abdomen and to feel the bowel and to feel if there is a blockage in there or if there is a load of stool that kind of needs to, come out. It's also possible to sometimes feel not only for the lumps of poo in the bowel, and to be able to, move that through. But also sometimes you can even feel, if there's gas in the bowel as well. And it's not unheard of for, someone to have an abdominal massage. They may well have a good fart. They may well feel, as you work down towards, the bottom of the pelvis, they may feel like they need a bit of a wee. That's normal, but it's not an issue. It just means that something's working. So, but, the reason also that you need to see an experienced practitioner is that, too much massage in one session may actually cause inflammation of the bowel, which obviously is then going to cause more problems, which is not what you want. So that's really important to make sure that you're seeing someone who is experienced and knows what they're doing, because, when you're already feeling really grim with IBS symptoms, or, you've got a child, with a blocked bowel, the last thing you want is to make that issue worse. So, so by basically clearing any congestion in the descending colon, improving that peristaltic movement, and just, again, providing a relaxing treatment, and also by reducing that pressure in the bowel, the chances of a successful treatment are actually extremely high, once the initial issue is sorted by doing this, by clearing that congestion, you can either then continue as a preventive measure, or just a normal regular massage will just help kind of maintain the health of the digestive system. So so that's the benefits, really, and I would say, in terms of childhood disability, say I for about 9 years I had experience with doing these abdominal treatments on children, sort of at every end of the scale, from just simple basic constipation for 1 or 2 days, right through to their bowel is blocked, X-ray has showed a huge blockage, and time to kind of get that moving. And sometimes I think with children, one of the standards, certainly with CP, one of the standard treatments, if they end up in hospital, is to either overload them with the Movicol, which is like the powdered laxative that you put into water or juice, which actually is, a lot of kids actually don't like the taste of that. And if they're not good drinkers, it doesn't work. So it can really, it's just another alternative to avoid going through that, or even going through, sometimes they'll want to put if they're not a good drinker, they'll want to put an NG tube down the child's nose to administer the Movicol that way. And again, you know, that can be really traumatic for a child. You know, I know of children that have had that done, and obviously that, you know, they just kind of panic. It's not nice for an adult, and for a child, you know, it just causes a lot of stress, and often, you know, will also just create negative feelings about being in hospital, which means that, you know, next time they need treatment for their disability, you know, they're going to react to it, you know, in not a very positive way, because they're going to have this bad memory from when they had an NG tube put down. So, you know, anything to avoid these issues really, you know, is a bonus, and yeah, definitely worth doing. So I would say to anyone, you know, if you're struggling with your child's disability and their bowel health, you know, find a therapist. You can always contact me with any questions, and I'll do my best to answer them. The other thing that I do, now I'm not sure how many other therapists that you'll find that do this, I actually also teach massage. So in addition to doing just, you know, the abdominal massage, I will also, you know, if it's required, I can also teach parents how to do it on their child, you know, which sometimes is just nice for that kind of bonding process, and it just helps the parent feel like they're involved and doing something good for their child as well. So that's another option. But so yeah, that is abdominal massage, and its benefits covered. And as always, any questions, please feel free to message me. There's links to my Facebook and Instagram. You can message me anytime and I will do my best to answer. But for now, that's it from me. So hope this has been of some help, and I will see you next time. Okay, bye.